Hello, Dr. Justin Mandel here from the Center for Upper Back Pain Relief, and I have the very first public service video right here, and this is ultra important. This is for patients that have been in pain. They're feeling upper back pain, middle back pain, lower back pain, and this is something that's just not been going away. We're going to go over 5 things that are on this board right behind me, but I wanted to give you a little background first. So after seeing tens of thousands of patients, I treat something around, I do about 30 to 40 treatments per day. These hands are on a lot of patients, and you're going to be able to benefit from that over the next couple of minutes because I'm going to present something to you that you probably don't know about. You've probably never heard from any of your doctors, and you might not have even have heard any of this online. So this is what we're going to do. We're going to go through 5 things. We're going to talk about who is affected. We're going to talk about the percentage of patients that are affected. We're going to talk about the MD trap. We're going to talk about the cause of patients' pain, and most importantly, we're going to talk about what you can do about it. Okay, so starting with number 1 over here, who? So this video is primarily for patients who have been told that their pain is due to herniated discs. And I can't even count how many thousands of times that I've seen this. The bottom line is this: around 60% of all patients that have been told that they have herniated discs, that is not the actual cause of their pain. Okay, let me repeat that one more time. It's very important. So if you've been told that you have a herniated disc, you might be one of the 60% of patients where that is not actually the case. All right. Let me explain, because this is probably very confusing to you. So I don't want you to fall into the MD trap like so many, I can't even count how many patients every single day fall into. And the way the MD trap works, it's very, very simple. Doctors these days, they're way too busy to go ahead and focus on one patient because they're taking insurance. They are seeing one patient every 3 to 5 minutes, 2 to 3 minutes maybe, something like that. Anyway, what doctors are doing these days is they're not relying on these anymore. They're not doing a thorough physical examination that they should be doing a lot of the time. So what they're doing is they're relying on the MRI results that they're getting. And it's sort of very third party in a sense because they're relying on another doctor's judgment, a radiologist's judgment, to be able to tell what's going on in the back. But the truth is that even though somebody does have a herniated disc, just like my mother, again, the cause of the actual pain is not necessarily the disc itself. So before we get to the cause, which is right over here, let's talk about my mother. So this is a very interesting situation. My mother had acute lower back pain for a pretty fair amount of time. And just like I told you, she would have fell into the MD trap. But what ended up happening was her doctor told her that she has a problem in her lower back caused by a herniated disc that's pressing on a nerve. Now, what's interesting is this. When I went to one of her appointments with her and I spoke to her doctor, he said something very, very interesting that is directly related to what we're talking about right now. And what he said is, I don't understand why your mother has lateral back pain. And the answer is very, very simple, actually. I just didn't have the time to go through it with him. But it turns out that the cause of my own mother's back pain was not the disc. The cause was actually poor blood circulation. Let me say that again. The cause was poor blood circulation. And in her case, what was happening, the lateral side of her back was the muscle was basically collapsed. And what happens is muscles are basically like balloons. They're filled up with blood. When they're filled up with blood, they're able to get all of the nutrition that the muscle needs, which does what? It helps to keep us out of pain. And that's not what was happening with my mother. So after a pretty long period of time, actually, her back is on the mend. The lateral portion of her back isn't collapsed like it used to be, but guess what? She still has her herniated discs. So she is a perfect example of how herniated discs are not necessarily the cause of someone's back pain. And let me bring up one other instance. I did a consultation for a patient the other day. She's had back pain, lower back pain that goes even further down by her sacrum and outward to her buttocks. And she has had back pain now for 2.5 years. And she's going through, all of the normal things that patients usually do. She's going for physical therapy. She's going for chiropractic care. And 2.5 years worth of treatment that has not remedied the situation. And of all things, what did she tell me? My pain is due to a herniated disc. So what I did was I used my 10 tools that you see right over here. I did basic physical examination that her doctors should have been doing the entire time, okay? And what I determined was that her problem was poor blood circulation. And in her case, the way that it manifested, not in my mother's case where there was a collapse of the muscle, but there was basically severe tenderness throughout the entire area. It was inside of her sacrum, it was outside of her sacrum, it radiated down towards her tailbone, and it was also in her lower back. So now that we went over all of this, let's get to the most important part. Most important part is, what can you do about it? And what I would implore you to do is go see your local licensed acupuncturist. They are an expert at remedying poor blood circulation, okay? Acupuncture, if you've never had it, in my opinion, the number one thing that it does is it rectifies poor blood circulation. What that means is that balloon that was collapsed, once those needles go in, it helps to bring fresh blood circulation back into the muscle. And guess what that does? That helps to fix collapsed muscles, and it also helps to take tenderness away. So I hope this video was really helpful for you. If you've been through the gauntlet of the medical system and you're like my mother, you're like this patient for 2.5 years, has been going for care and not getting any better, go see a second opinion from your local licensed acupuncturist. It could be the very best thing that you do this year. So, Dr. Justin Mandel signing off from the Center for Upper Back Pain Relief. And once again, I hope this video was very helpful to you.